Next up on Saturday mornings at your service, it's Welcome to Health. Greatest Brains and the Welcome to Health Center bring you Dr. Kurt Rexroth, chiropractor and clinical nutritionist. Dr. Rexroth is here to answer your questions about chiropractic, nutrition, or healthy weight loss. So give Dr. Rexroth a call at 344-1420, or you can find him online at welcometohealth.com. And now here's Dr. Kurt Rexroth.
Good morning, Quad Cities. I tell you, we've got a great show today. We're going to actually talk about chiropractic. Surprise, surprise. We're going to be doing it today. We're going to be talking about how important it is and how we get ourselves into trouble and begin needing a chiropractor. We're also going to be talking about general concepts of health and why it is that for over a century now, chiropractic has had a certain philosophy or a certain approach to health in general. It's very, very important that we understand how central chiropractic is to health. First of all, let's just review what chiropractic deals with. Chiropractic deals with the spinal column. That spinal column goes all the way from the base of the skull at the first vertebra. In fact, you can remember the name of that vertebra because you all know the Greek god Atlas who holds the earth on his shoulders. Well, that first vertebra is called the atlas because it holds the orb of the skull or the head on its shoulders. So the atlas vertebra is the first vertebra, probably the most important because every nerve that comes from the brain and goes down to the rest of the body and to the very tips of the fingers and the very tips of the toes has to go past that particular vertebra. And then it goes down through the axis vertebra, which is what enables us to turn our head well. That's why it's called an axis. It's a kind of a tooth that comes up and the atlas revolves around that. And so, we've got these two first vertebrae, very, very important, but every vertebra below that is important relative to what happens in the body below it. So the top ones are probably the most vital, and then as we go down, each of them has a role in what happens below it. And that's kind of easy because what happens is everything that happens in the body has to communicate with the brain. The brain's kind of the central control system. It receives, processes, and then gives commands to the rest of the body. And so when you're thinking about chiropractic, you're also thinking about the function of the brain and its command structure in coordinating everything that happens in the body. And as science gets more and more sophisticated, we learn more and more about how central the nervous system is. For example, one of the things that people don't quite realize is that even the hormones have a basket of nerves around them. And these little hormone cells have an interaction with the nervous system. So if you have a particular, you kind of should know this really, because if you are shocked, in other words, your sense of sight, your sense of hearing tells you that there's a danger in the room, what happens immediately? You are flooded with hormones that get you ready, flooded with adrenaline immediately to get you ready for some kind of danger, okay? And so, of course, it's vital that there be a instantaneous reaction on the nervous system and communicating directly with the hormonal system. So that's how intimate it is. Now, hormones, of course, control a lot of things too, and they actually interact with the nervous system. In fact, everything in the body is so tightly coordinated on one hand, and yet so loosely filled with different feedback loops and information systems. In every smallest little bit, there are information systems that have interlocking feedback loops, and the large system has large neurological feedback loops. But all of these systems are interacting, and every part of your body has some sense of what other parts of your body are doing, okay? Now, I would love to get into all the physiology in detail. I'm having to fight myself not to, but just on one illustration, let's just make the illustration because this relates directly to our topic today, chiropractic, and how it is that certain neurological patterns get locked in and get difficult to break, okay? For example, suppose you've got a side of your back that has a tendency to spasm, something that is just even, going to the chiropractor, you have a difficult time releasing those spasms and getting those muscles to balance out. Well, where did that habitual pattern come from is the question. So let's just tell a little story. Okay, you're in your kitchen, you're at your stove and you're having a good time cooking a meal, and your mind is kind of wandering, and you got most of your behavior on an automatic level because you're a good cook. But in this automatic behavior, you get distracted, you accidentally touch the stove with your right hand. Well, what's going to happen? You get the burning sensation, and before you even can acknowledge, before you even know that you've been burned, your hand is already violently withdrawn from the stove. Your whole body here responds. Your leg muscles tighten and throw you away from the stove. Your head, kind of jerks back on one side. Your shoulder muscles and your back muscles become extraordinarily tight. And your feet even, form a certain pattern of coordination to move you away from the danger. Now, the opposite side of the body has to do all the opposite things. It has to relax certain muscles to allow for that. It has to coordinate a stability contraction of some muscles so that you don't just fly over and fall on the floor, right? But all of these things are so well coordinated through the nervous system as a kind of a knee-jerk response, a response to get away from the danger. Well, what happens is, if that's a violent enough occurrence, many of those muscle tensions, those muscle contractions, actually become locked into place. Because one of the things that happens as a result of neurological patterning is that if nerves fire together, they wire together, and that particular pathway becomes more facilitated. It becomes easier for the nerve impulses to pass through those particular pathways. So if there's something you do over and over again, and it's something that forms a pattern in your behavior, those particular patterns are going to become wired together, become easier, okay? So if you happen to get careless and touch the stove again and that same thing happens, oh my gosh, the body's going to say, I better make this a habit. I better make this a wired together pattern, because nerves that fire together wire together, okay? Now, when that happens, and this can happen on many different levels. I'm just talking about a very describable level of behavior. But when that kind of thing happens, you start developing muscle tension patterns that will pull the spine in a certain way. There are certain, these are adaptive patterns, and they're good patterns. I mean, let's face it, the body is trying to take care of you. It's trying to make it so that these dangerous things are less likely to happen. Of course, memory of these dangerous things also hopefully will alert you to staying away, keeping your fingers away from hot surfaces and things like that. But all of these different patterns are going to lock in, and they're going to form imbalances perhaps. Well, one of the things that chiropractors do is they go in and they look for these patterns. For example, you've got that shoulder blade area that's just gnawing at you all the time, and you stretch it out and it helps a little bit, but it just gnaws at you, and you kind of notice that the right side of your neck the lower neck is just a little bit. And these kind of patterns kind of get locked in there. And the question is, how do we break these patterns so that you can balance your anatomy out again, balance your physiology out, so that those things aren't tugging on your spinal column and causing what chiropractors call subluxations. A subluxation is a misalignment, or even more, a time when the spine actually locks up and cannot move properly. And when that happens, when that lock happens, either through muscular contraction or through just physiological, and physical locking up, when that happens, other bad things start to happen. So what is it that chiropractors do? One of the things they do is they read the patterns of the body. They read what is happening in this part and how it may relate neurologically to other parts. Because the thing we just described in terms of that shoulder blade pain and the neck pain, the nerve that goes into the shoulder blade comes out of the lower neck. And as it comes out of that lower neck, it goes into that muscle. And if the muscles and the joints of the lower neck are having problems, then that can perpetuate a chronic condition in the upper back. It can even eventually lead to tingling in the fingers. Okay, and if it's the muscle, if that's that muscle in the upper backs, it's usually the thumb and the index finger, the third finger, and half of the fourth finger of the hand that may be in a kind of a state where it gets tingling. Okay, so that's what chiropractors do. They read the signs and symptoms that the patient comes in with to try to figure out what part of the spine may be involved and what part of the communication from the brain and back to the brain may be impaired. Okay, that's the first step. Okay, we've been talking about how chiropractors read the body and then discover certain patterns that point back to the spine, tell the chiropractor what may be happening in the spine to actually block communication from the brain through the nervous system to those parts of the body. In fact, many of you have experienced this with chiropractors already, I'm sure, because some of you go in with the stomach problems, for example, indigestion and things, and you, after a while with the chiropractor and through the education, find out that, wow, the nervous system can actually create problems with the stomach and digestion, and the chiropractor actually helps you by relieving a certain part in your middle back that sends the nerves to the stomach. So, a lot of you have actually experienced that already, I'm sure, with your chiropractor. And what do chiropractors do? Well, let's talk a little bit about joint physiology, because as most of you know, chiropractors work with spinal joints. And there are many things that can happen. Some of the things that happen with spinal joints are actually congenital. For example, you can come in and the chiropractor will tell you, well, you've got some altered mechanics in the lower back because due to your mom's inattention to eating green vegetables and things that contain folate when you were just fertilized, a freshly fertilized egg, your spine did not form properly, and your lumbar vertebra is trying to become a sacrum, or your sacrum has produced an extra lumbar vertebra, or your spine is weak and you have a spondylolisthesis. That means the lower vertebra is slipped forward on the sacrum because, well, your mom didn't eat enough vegetables because she needed more folate and it just didn't develop well down here in the bottom of the spine. Okay? And some of you have heard those kinds of things. And sometimes that creates a situation that the body manages these situations for the most part very, very well, even when there are deformities in the spine that come congenitally, namely, as a result of things not forming well early in life. The body usually responds pretty well to those things, and you have a wonderful life without a whole lot of problems. But every once in a while, the problems creep up, and finally they manifest, and then you've got to manage the problem. But let's just talk about normal spines that have normal joints, at least at some point in their life until they're damaged, and then they run into trouble because joints are all constructed roughly the same. Imagine if you put your hands out and you look at your palms, and you imagine that there are cartilage surfaces on the palms of your hands, and then you put them together and you rub them together just lightly, about an inch up and an inch down. Well, that's kind of the way most joints are, okay, and particularly spinal joints. So all joints consist of this. You have a bone that has a cartilage surface together with a bone that has a cartilage surface and a bone. So you have two cartilage surfaces facing each other, and those surfaces are surrounded by lubricating fluid that is also a nutrient bath. In other words, the nutrition is in that fluid. Now, by nutrition, I mean oxygen, food, the waste products that come from the live cartilage cells, and the waste product of carbon dioxide that comes, because cartilage cells are living cells, so they need oxygen, they need food, they need to get rid of their wastes, all right? So you have these two surfaces that come together, and the cartilage gives them a nice slick surface, like a plastic bushing or something, but it needs nutrition. Now, what happens, though, is this, that the one fact about cartilage that is probably the most important thing is that cartilage as a living tissue has no capillaries. It has no blood supply of its own. And so the question then is, how does it get its oxygen? How does it get its nutrition? How does it get rid of its sewage? And how does it get rid of its carbon dioxide? Well, the answer is very simple. The fluid that surrounds it contains all of those things. And cartilage doesn't need much because it's very slow metabolic tissue. Doesn't need much, but it needs to have motion It needs to have joints, which are by the only reason you have a joint, of course, is to move. And it's fortunate because the only way cartilage gets nutrition is through motion. It has to compress the carbon dioxide and the waste products out and draw in or sponge in the oxygen and the nutrition. Now, that means that if cartilage and joints are not moving properly, they are by definition sick. Because a joint that is not moving properly has sick cartilage. The cartilage is gasping for oxygen, it's starving for food, it's backing up with sewage, and it's being smothered by carbon dioxide. So cartilage has to move. It has to compress and decompress. It has to sponge it out and sponge it in. Otherwise, it starts to get very sick. Now, so if you've got that muscle spasm that is locking that joint down and preventing it from moving, the cartilage is getting sick, the joint is getting sick, and swelling can happen. If you've got a damaged joint where, because of a car accident or a sports injury, that joint is, there's a stretching of the ligament around the joint so it can move outside its normal range, and it hangs out in a lower gravity position, so, and it can't quite get up over the hump, that joint is going to start to get very, very sick. All right, so because it's going to be starving to death and dying of suffocation. So anyway, you want to get that joint moving. And that joint, when you can get it moving, then what happens is you start getting the exchange of nutrition and waste products, and the joint cartilage starts getting healthy again, the inflammation goes down. But the inflammation is actually even a bigger problem, because when that joint gets sick and starts inflaming and the joint capsule, the sac around the joint starts swelling, it can swell right into the nerve. And when it does that, then all this communication we've been talking about, from the brain to the rest of the body, from the brain to the legs, etc., all that communication is interrupted, and you start getting bad information. And when that happens, then things start going wrong. You can start having pain, which is, of course, a signal that you better do something, or you can start getting tissue problems in the legs, you can start getting neuropathy, you can start getting tingling and a lack of sensation, and all of this stuff can go wrong if you're not getting reliable communication. And that happens because the sac around that joint we've been talking about swells up, and it swells right into the nerve and compresses the nerve, and then the nerve cannot get the information through. So it's vital that we get this joint moving again, and that's what chiropractors do. In a very simple, just a couple of words, chiropractors find joints that aren't moving, and what do? They move them, and they move them in the optimal direction so that if you got a joint that's hung up and in a low gravity position and can't get over the hump, we help it get over the hump. If you've got a joint that is locked down because of muscle contraction in a particular area, we find which nerve is telling those muscles to contract. We get the communication to those muscles worked out so that they now can relax, and then we get normal muscle tension, and the joints can move again, the cartilage can get their nutrition again, and the joint gets healthy again. And that's what chiropractic fundamentally is all about. So when we're looking at you and doing an exam at the first, and we're looking for all these different patterns, muscle tension, swollen joints, we're looking at pain patterns, what types of things are going on. We're listening to the patient talk about the pain down the leg, or pain into the buttock, pain in the sacroiliac joints, all of these different things. We're tuning into the question of which joint is causing the problem in this particular case. So what I would like you to do is invite you to the Welcome to Health Center, because this is what we do. This is the primary focus of our business, is to get people's joints working well so the communication is good again, so the pain and the muscle tension patterns are lowered, and so that everything gets cleared up. Give us a call at the office, and we would absolutely love to meet you, and we would love to help you through your health problems. Talk to you next week. Bye-bye.
Thanks for listening to Welcome to Health with Dr. Kurt Rexroth, part of Saturday Mornings at Your Service, sponsored by the Welcome to Health Center and Greatest Grains. Dr. Rexroth will be back next week at the same time. If you have a question before then, give the good doctor a call at 309-764-2115 or find him online at welcometohealth.com, where you can download podcasts of this program.